pathologists are indispensable to the operation of our medical system. But who are they and what do they actually do? Dr. Adrian Morey is an anatomical pathologist, also known as a histopathologist at a major metropolitan hospital.
On a day-to-day basis, I'd look at between 20 to 50 cases, but it depends. They can vary from a very simple skin biopsy through to a biopsy from a heart transplant patient who's rejecting, right through to a full mastectomy or a full colon cancer. Each case will have from 1 to 90 slides on it, depending on how big the case is. So, yeah, the number of cases we do isn't necessarily a reflection of the amount of work we're doing. Thanks. If a surgeon is removing a breast cancer, he may well have done a special radioactive marker test to determine if one of the nodes in the axilla is involved. That will be sent to us as a rush frozen section. It's treated as a crisis. Everyone drops tools and attends to it and gets the result through to the surgeon in a couple of minutes. And that will then determine how he proceeds in the rest of the operation. And we have to get it right. The buck stops with us. Those nodes are clear of tumour. Every specimen that comes to anatomical pathology will end up being handled by multiple doctors. The process known as cut-up is where one of our trainee pathologists dissects the specimen in order to show the critical characteristics of the lesion in the specimen and the margins and any other prognostic indicators that are required for us to put the correct report out. They'll often need to be supervised by a qualified pathologist in getting that dissection correct. To just recheck the axillary fat.
After the dissection is completed, the selected pieces of tissue are sent for processing by highly trained technicians. These slides are then returned to the pathologist for reporting. Each slide is reviewed individually, and depending upon the findings, further testing may be required.
Often then it'll have to be sent off for additional special stains or even molecular markers like the FISH test to fully characterise that tumour.
Tools like the FISH test can identify certain genetic markers in the tumour that enable pathologists to help determine the best treatment for each patient individually. These tests may take several days and require the pathologist's ongoing involvement at each step of the process. But the work of Dr. Morey doesn't end there. She also supervises a collection hub for the New South Wales Breast Tumour Bank, which takes samples from consenting patients to further research into the disease. Plus, she runs a unique national reference lab that utilises a DNA probe technique vital in the treatment of breast cancer sufferers. Given that these new target therapies are only effective for patients whose cancers have a particular genetic makeup, it's critical that patients who will benefit from the treatment are identified. All this on top of Dr. Morey's day-to-day diagnostic role.
Most people wouldn't realise it would take me longer to look at an excised breast cancer than it took the surgeon to cut it out. Even having reported the case, our role doesn't stop there. We'll have to present that case at a multidisciplinary team meeting where colleagues from oncology, radiology and the surgeons, of course, meet together to discuss the case, to demonstrate the pathology and to plan what the appropriate treatment is for that patient. So there you've got the myxoid matrix and the physoliphrous
Training
cells.
as a pathologist is like an apprenticeship, requiring hands-on experience. So part of Dr. Morey's day-to-day role is also to supervise the 5 trainees in her department.
What tissue are we in, Manal?
As they complete the necessary steps to become pathologists.
In that particular case, it's picking up the tumour quite well.
While Dr. Morey is an anatomical pathologist, pathologists in general play a much wider role than just diagnosing cancer. Pathologists are actually involved in diagnosing almost 70% of disease and work across a range of different specialities. These include chemical pathology, which deals with the entire range of disease and encompasses detecting changes in a number of substances in blood and body fluids, such as electrolytes, enzymes and proteins. Forensic pathology, which seeks to investigate and define the cause of unexpected death. Genetics, which looks at chromosomes and DNA from cells to diagnose genetic diseases. Hematology, which deals with diseases which affect the blood, such as anemia, leukemia, lymphoma, and clotting or bleeding disorders. Immunopathology, which looks at allergic reactions, autoimmune disorders, such as diabetes, rheumatoid arthritis, and thyroid conditions. microbiology, which deals with diseases caused by infectious agents such as bacteria, viruses, fungi and parasites, and general pathology, which covers the profession as a whole.
Pathology is the basis of medicine. Understanding pathology is critical to understanding the disease that you're dealing with.